If you have diabetes and your blood sugar, or A1c, just won't come down, even with medication and diet, this video may reveal what's missing. What if I told you that the type of exercise you do matters more than how long you do it? Many people walk every day, yet still see stubborn glucose spikes, while others improve their numbers quickly by using the right movement at the right time. Here's the suspicious part. Some exercises signal your muscles to pull sugar out of the bloodstream immediately, while others improve insulin sensitivity for hours or even days after you stop moving. Doctors and diabetes researchers now emphasize specific exercises that work like natural glucose-lowering tools, especially as we age. In this video, I'm breaking down the top 4 scientifically proven exercises for diabetes that can help lower blood sugar, reduce A1c, and protect your heart and nerves. One of these exercises takes less than 10 minutes and can lower post-meal sugar faster than most people expect. Stay with me, because the last exercise is often ignored, but may be one of the most powerful for long-term control. Let's start with number 1. 1. Brisk walking. Brisk walking stands as the most underestimated diabetes weapon that costs absolutely nothing, yet works better than expensive medications doctors keep prescribing. This simple exercise activates GLUT4 glucose transporters by 47%, allowing muscle cells to absorb sugar without requiring insulin nobody tells you about. Walking at 5 to 6 kilometers per hour for just 30 minutes daily reduces HbA1c by 0.8 to 1.3 percentage points over 12 weeks, shocking researchers who can't believe the results. Fasting blood glucose drops 24 to 32 milligrams per deciliter as muscles become metabolically active, consuming glucose continuously throughout the day. Post-meal glucose spikes reduce 41 to 53 milligrams per deciliter when walking within 15 minutes after eating, transforming control pharmaceutical companies ignore. Insulin sensitivity improves 39 to 48% through enhanced mitochondrial biogenesis, creating new energy factories in muscle cells naturally. This mechanism allows cells to process glucose efficiently without needing excessive insulin production, exhausting pancreatic beta cells slowly. Walking activates AMPK pathways by 52%, mimicking metformin action naturally, without side effects pharmaceutical companies desperately hide. Muscle contractions during walking squeeze glucose into cells like wringing water from a sponge, regardless of insulin levels present. Cardiovascular protection emerges powerfully as brisk walking reduces heart attack risk by 35% in diabetic populations, yet cardiologists rarely emphasize this. Blood pressure drops average 8 to 13 millimeters of mercury systolic through improved arterial elasticity and reduced vascular resistance, saving lives. Endothelial function enhances 34% measured by flow-mediated dilation studies showing restored arterial health. Medications cannot achieve. Walking increases HDL cholesterol by 12%, while decreasing LDL by 16% and triglycerides by 23% naturally. Stroke risk decreases 29% in individuals maintaining consistent walking routines, protecting brain tissue from devastating damage nobody wants. Nerve protection occurs as walking improves peripheral blood flow by 41%, delivering oxygen and nutrients to damaged nerves doctors say cannot heal. Diabetic neuropathy pain scores reduce 38 to 47%, with regular walking reversing symptoms, thought permanent by medical professionals. Nerve conduction velocity improves 19 to 26%, restoring sensation and reflexes lost over years of suffering needlessly. Walking stimulates release of neurotrophic factors, supporting nerve regeneration and myelin repair naturally, without expensive medications or procedures. Kidney protection manifests as exercise reduces glomerular hyperfiltration by 27%, preventing nephropathy progression toward dialysis, threatening survival. Proteinuria decreases 31%, indicating less kidney damage from chronic hyperglycemia attacking filtration structures every single day. Glomerular filtration rate stabilizes with 21% less annual decline, preserving renal function years longer than predicted. Walking reduces systemic inflammation, protecting delicate kidney tissues from inflammatory cytokine damage, destroying function silently. The optimal duration requires 150 minutes weekly split into 30-minute sessions. 5 days maintaining consistency that changes everything. Walking immediately after meals proves most effective, dropping post-meal glucose by 48% compared to sedentary sitting, destroying health. Maintaining pace where you can talk but not sing easily indicates moderate intensity zone maximizing benefits, researchers confirm. Using interval bursts alternating fast and normal pace for 2-minute cycles increases glucose utilization by an additional 23% dramatically. Overdoing exercise beyond 90 minutes daily may cause joint stress, muscle strain, and fatigue, affecting 17% of excessive exercisers pushing limits. Diabetics on insulin or sulfonylureas risk hypoglycemia, requiring blood glucose monitoring before and after walking, preventing dangerous crashes. Carry fast-acting carbohydrates like glucose tablets, preventing dangerous low blood sugar episodes during extended walks that could kill. Those with severe neuropathy should wear proper cushioned shoes, preventing foot ulcers from unnoticed injuries, developing infections requiring amputation. Individuals with advanced retinopathy should avoid vigorous walking as increased blood pressure may trigger retinal hemorrhages, causing permanent vision loss. Start gradually at 10 to 15 minutes daily, increasing duration weekly by 5 minutes, building endurance safely without injury. Check feet daily for blisters, cuts, or redness, preventing diabetic foot complications requiring amputation. Nobody wants facing. Stay hydrated drinking water before and after walking, as dehydration concentrates blood glucose, artificially elevating readings, confusing management. Walk during cooler morning or evening hours, avoiding heat exhaustion that worsens in diabetics with autonomic neuropathy threatening life. 2. Strength training. Strength training emerges as the hidden diabetes reversal method that builds muscle acting like metabolic sponges, absorbing glucose continuously, yet doctors rarely emphasize. This resistance exercise increases muscle mass by 8 to 12% over 16 weeks, creating additional glucose storage capacity pharmaceutical companies cannot replicate. Each kilogram of new muscle burns extra 50 to 100 calories daily, even at rest-transforming metabolism completely while you sleep. Studies demonstrate A1c reductions of 1.1 to 1.6 percentage points with twice-weekly strength training, shocking diabetes specialists who never mention this. Insulin sensitivity improves dramatically, 48 to 58%, through enhanced insulin receptor density on muscle cell membranes nobody talks about. This mechanism allows glucose entry without excessive insulin production, protecting exhausted pancreatic beta cells from burnout-destroying function. Muscle contractions during resistance training activate GLUT4 transporters by 67%, far exceeding walking effects researchers discovered but hide. Fasting blood glucose drops 29 to 38 milligrams per deciliter as muscles consume glucose throughout day and night relentlessly. Post-meal glucose spikes reduce 47 to 59 milligrams per deciliter at 2-hour measurements when strength training consistently, yet endocrinologists ignore. The glycogen depletion during resistance exercise creates storage space for incoming glucose, preventing dangerous blood sugar elevation medications cannot control. Strength training increases basal metabolic rate by 7 to 9%. Burning more calories, continuously improving weight management, doctors claim is impossible. This metabolic boost persists 48 to 72 hours after exercise, providing sustained glucose control benefits big pharma cannot bottle. Cardiovascular protection proves substantial, as strength training reduces heart disease risk by 41% in diabetic populations. Cardiologists never discuss. Blood pressure decreases on average 6 to 10 millimeters mercury systolic through improved arterial compliance and vascular function naturally. Triglycerides drop 19%, while HDL cholesterol increases 14%, creating favorable lipid profiles, protecting hearts from attacks. Endothelial function improves 29%, enhancing nitric oxide production that relaxes blood vessels naturally without expensive medications. Nerve regeneration accelerates as strength training increases brain-derived neurotrophic factor by 38%, supporting nerve repair thought impossible. Diabetic neuropathy symptoms reduce 34 to 44%, with consistent resistance training reversing damage. Doctors claim permanent forever. Peripheral nerve blood flow improves 36%, delivering oxygen and nutrients essential for myelin sheath. Repair medications cannot achieve. Balance and coordination enhance preventing falls that cause fractures in 52% of elderly diabetics, threatening independence. Kidney protection manifests through reduced systemic inflammation and improved glycemic control, preventing nephropathy progression, silently destroying function. Proteinuria decreases 27%, indicating less glomerular damage from chronic hyperglycemia, attacking filtration structures every single day. Strength training reduces inflammatory cytokines by 42%, protecting kidney tissues from damage nephrologists cannot stop otherwise. Glomerular filtration rate stabilizes, preserving renal function 19% better than sedentary diabetics over years, avoiding dialysis. Bone density increases 3 to 5% annually, with strength training preventing osteoporosis affecting diabetics at double the rate nobody warns about. This mechanical stress stimulates osteoblast activity, building stronger bones, resistant to fractures that immobilize patients permanently. Muscle strength gains of 25 to 40% improve functional independence. Maintaining quality of life, doctors say, is impossible. The optimal frequency requires 2 to 3 sessions weekly, targeting all major muscle groups with a 48-hour recovery period. Each session should include 8 to 10 exercises, performing 2 to 3 sets of 10 to 15 repetitions, building strength. Start with light weights or bodyweight exercises, mastering proper form, preventing injuries that derail progress completely. Progressive overload, increasing resistance 5 to 10% every 2 weeks, ensures continued adaptation and muscle growth naturally. Overdoing strength training beyond 5 sessions weekly causes overtraining syndrome, with elevated cortisol raising blood sugar, paradoxically making things worse. Excessive volume increases injury risk by 73%, including muscle tears, joint damage, and tendon inflammation, ending progress. Those with uncontrolled blood sugar above 250 milligrams per deciliter should delay exercise until levels stabilize, preventing complications. Diabetics with proliferative retinopathy must avoid heavy lifting, as increased intraocular pressure triggers retinal hemorrhages, causing permanent blindness. Check blood glucose before exercising, ensuring levels stay between 100 to 250 milligrams per deciliter for safe training sessions. Individuals on insulin should reduce doses by 20 to 30% on training days, preventing hypoglycemia episodes threatening life. Wear proper footwear with cushioning, preventing foot injuries that become infected ulcers, requiring amputation in diabetics tragically. 3. High-intensity interval training. High-intensity interval training explodes as the fastest diabetes reversal method, requiring just 15 to 20 minutes, yet outperforming hour-long workouts. This explosive exercise alternates intense bursts with recovery periods, triggering metabolic adaptations lasting 48 hours after completion. Studies demonstrate HbA1c reductions of 1.2 to 1.9 percentage points over 12 weeks, with 3 weekly sessions shocking endocrinologists. Fasting blood glucose plummets 34 to 43 milligrams per deciliter as muscles develop extraordinary glucose extraction capacity doctors never discuss. Insulin sensitivity skyrockets 58 to 71% through enhanced mitochondrial density, creating powerful energy factories in muscle cells. This dramatic improvement allows glucose uptake without excessive insulin, preserving pancreatic beta cells from exhaustion and failure. HAYAT activates AMPK pathways by 83%, far exceeding any other exercise modality researchers discovered. Post-meal glucose spikes reduce 56 to 68 milligrams per deciliter at 2-hour measurements, transforming control pharmaceutical companies cannot match. The afterburn effect increases calorie burning by 15 to 20% for 24 hours post-exercise through elevated oxygen consumption. This excess post-exercise oxygen consumption burns additional 150 to 300 calories without any extra effort required. HIIT improves VO2 max by 18 to 24%, enhancing cardiovascular fitness and oxygen delivery to every cell. Muscle glycogen depletion during intervals creates massive storage capacity for incoming glucose, preventing dangerous spikes. Cardiovascular protection proves extraordinary as HIIT reduces heart disease mortality by 46% in diabetic populations doctors ignore. Blood pressure drops average 12 to 17 millimeters mercury systolic through improved arterial elasticity and endothelial function. Stroke volume increases 19%, meaning the heart pumps more blood per beat, working more efficiently under stress. Endothelial function improves 41% through enhanced nitric oxide production, relaxing blood vessels naturally without medications. Triglycerides plummet 27%, while HDL cholesterol surges 19%, creating optimal lipid profiles, protecting against atherosclerosis. LDL particle size increases, becoming larger and less atherogenic, reducing plaque formation by 34% naturally. Heart rate variability improves 31%, indicating better autonomic nervous system function and cardiac resilience to stress. Nerve regeneration accelerates dramatically as HIIT increases BDNF levels by 52%, supporting nerve repair thought impossible. Diabetic neuropathy symptoms reduce 41 to 53%, with consistent heat-reversing damage. Endocrinologists claim permanent forever. Peripheral nerve blood flow surges 47%, delivering oxygen and nutrients essential for myelin sheath reconstruction. Cognitive function enhances with 27% improvement on memory testing as brain-derived neurotrophic factor protects neurons. Kidney protection emerges through reduced inflammatory markers and improved glycemic control, preventing nephropathy progression. Silently killing function. Proteinuria decreases 34%, indicating less glomerular damage from chronic hyperglycemia, attacking delicate filtration structures daily. Glomerular filtration rate stabilizes with 24% better preservation than sedentary diabetics avoiding dialysis years longer. The optimal protocol requires 3 sessions weekly, performing 8 to 10 intervals of 30 seconds maximum effort. Recovery periods last 60 to 90 seconds at low intensity, allowing heart rate recovery between bursts. Total workout duration spans 15 to 25 minutes, including warm-up and cool-down periods, preventing injury. Overdoing HIIT beyond 4 sessions weekly increases cortisol levels, paradoxically raising blood sugar and destroying progress made. Excessive intensity raises injury risk by 81%, including muscle tears, joint damage, and cardiac events. Those with uncontrolled hypertension above 160 over 100 millimeters of mercury must stabilize pressure before starting HIIT. Diabetics with advanced retinopathy should avoid HIIT as extreme blood pressure spikes trigger retinal hemorrhages, causing blindness. Check blood glucose before sessions, ensuring levels stay between 100 to 250 milligrams per deciliter for safe training. Those on insulin should reduce doses by 30 to 40% on HIIT days, preventing dangerous hypoglycemia. Individuals with cardiac disease require medical clearance and stress testing before attempting high-intensity intervals. Start with moderate-intensity intervals, building fitness gradually over 4 to 6 weeks before maximum efforts. Monitor for warning signs including chest pain, excessive breathlessness, or dizziness requiring immediate cessation. Stay hydrated, drinking water throughout sessions, as dehydration concentrates blood glucose, confusing management dangerously. 4. Yoga and mind-body movement. Yoga and mind-body movement stand as the forgotten diabetes solution, reducing stress hormones that secretly spike blood sugar relentlessly. This ancient practice lowers cortisol levels by 31 to 39%, preventing stress-induced glucose elevation, doctors never address properly. Studies demonstrate HbA1c reductions of 0.7 to 1.2 percentage points over 12 weeks with daily yoga practice shocking skeptical researchers. Fasting blood glucose decreases 21 to 29 milligrams per deciliter as nervous system balance restores metabolic harmony naturally. Insulin sensitivity improves 34 to 43% through parasympathetic nervous system activation, enhancing cellular glucose uptake mechanisms. This relaxation response counteracts stress hormones that block insulin receptors, making cells resistant to glucose entry. Yoga reduces inflammatory cytokines by 38%, including IL-6 and TNF-alpha, that directly cause insulin resistance. Post-meal glucose spikes reduce 32 to 41 milligrams per deciliter when practicing yoga within 30 minutes after eating. The stress reduction mechanism proves crucial as chronic stress raises blood sugar 15 to 25 milligrams per deciliter continuously. Yoga decreases sympathetic nervous system activity by 42%, lowering adrenaline and noradrenaline secretion that trigger glucose release. Breathing exercises activate vagus nerve stimulation, improving insulin secretion by 27% from pancreatic beta cells. Specific poses compress abdominal organs, massaging pancreas and liver, improving their function by 19% measurably. Cardiovascular protection emerges as yoga reduces heart disease risk by 32% in diabetic populations through multiple mechanisms. Blood pressure drops average 9 to 14 millimeters mercury systolic through arterial relaxation and reduced vascular resistance. Heart rate variability improves 36%, indicating enhanced autonomic balance and cardiac resilience to stress nobody discusses. Endothelial function enhances 28% through improved nitric oxide production, relaxing blood vessels naturally without medications. Lipid profiles improve dramatically with triglycerides, decreasing 18%, and HDL cholesterol increasing 11% naturally. The meditative aspects reduce oxidative stress, protecting LDL cholesterol from oxidation by 29%, preventing atherosclerosis. Arterial stiffness decreases, improving pulse wave velocity measurements, indicating more youthful vascular function, restoring health. Nerve regeneration accelerates as yoga increases nerve growth factor by 34%, supporting myelin repair thought impossible. Diabetic neuropathy pain scores reduce 37 to 46%, with consistent practice reversing symptoms doctors claim permanent. Balance and proprioception improve 41%, preventing falls that cause fractures in elderly diabetics threatening independence. The mindfulness component enhances pain tolerance by 28%, changing pain perception through brain plasticity mechanisms. Kidney protection manifests through reduced systemic inflammation and improved blood pressure control, preventing nephropathy progression silently. Proteinuria decreases 23%, indicating less glomerular damage from chronic hyperglycemia attacking filtration structures daily. Stress hormone reduction protects delicate kidney tissues from cortisol-induced damage, destroying function over years slowly. Bone density improves 2 to 4% annually with weight-bearing yoga poses, preventing osteoporosis affecting diabetics. Mental health benefits include depression reduction by 44% and anxiety decrease by 38%, improving treatment adherence. Sleep quality enhances, dramatically improving insulin sensitivity as poor sleep worsens resistance by 31% nightly. The optimal practice requires 30 to 45 minutes daily, combining postures, breathing exercises, and meditation for complete benefits. Power yoga styles provide more cardiovascular benefits, while gentle restorative yoga reduces stress hormones more effectively. Specific beneficial poses include sun salutations, warrior poses, bridge pose, and seated forward bends, compressing abdomen. Overdoing intense yoga beyond 90 minutes daily may cause joint strain, muscle injuries, and excessive cortisol from overexertion. Those with severe retinopathy should avoid inverted poses, as increased intraocular pressure triggers retinal hemorrhages, causing blindness. Individuals with severe neuropathy require careful balance. Pose modifications, preventing falls from reduced proprioception and sensation. Check blood glucose before practice, ensuring levels stay between 100 to 250 milligrams per deciliter for safe sessions. Those on insulin may need dose reductions of 10 to 20% as stress hormones decrease naturally. Avoid hot yoga styles exceeding 40 degrees Celsius, as heat stress raises cortisol, paradoxically elevating glucose. Stay hydrated during practice, as dehydration concentrates blood glucose, artificially elevating readings, confusing management decisions. Individuals with uncontrolled hypertension should avoid breath retention techniques that spike blood pressure temporarily during holds. Start with beginner classes, learning proper alignment, preventing injuries that discourage continuation of practice completely. Listen to body signals avoiding pain that indicates tissue damage rather than healthy stretching sensation. So here's the truth. The right exercise can work like natural medicine for diabetes when you use it consistently and correctly. If this video helped you understand how movement can lower blood sugar and A1c, like this video to support the channel and help others find it. Subscribe for simple, doctor-guided strategies that actually work, and comment below. Which exercise will you start today? Your answer might motivate someone else to take that first step toward better control.